Welcome to this session. This session's got a bit of a different format. It's a town hall session, which means if you think it's time to relax and chill and think about what next, that's absolutely wrong. Gonna need your contributions, your thoughts, your questions, your ideas. And the topic is mental health at the time of COVID. So to kick us off, I'm delighted to welcome onto the stage Afiba Nyamekye. Afiba, economist, data scientist at ATB Financial, focusing on social impact. So please take the stage.
Thank you, Emily. Hello to everyone. I'm sure there will be very few of us here who could say that COVID has not impinged on our mental health one way or other. So I hope as the rest of the panelists join, we'll have a very fruitful and meaningful discussion. Alrighty, screens are up, great. Okay, so because I'm an economist and data scientist, my little presentation is going to focus primarily on the data gaps and opportunities. So to provide a bit of an overview, I feel like I'll stand. It's a little too high. I don't want to tip over. I'll just share a little bit of context around what mental health looked like pre-pandemic, and then look at the impacts globally in Canada, and then the opportunities and gaps, what works according to the experts in the field, and then finally close off by giving a bit of an overview of what we at ATB Financial are doing. So pre-COVID, the stats here will not surprise most of you. The global mental health system was really in a state of crisis. So whether we're talking about the world or here in Canada, we had lots of people, considerable number of people grappling with various mental health disorders. And so what the UN reported is that 1 in 4 people are estimated to experience some sort of mental health issue, illness, disorder at some point in their lifetime. It's also a leading cause of disability and disease burden. And here in Canada, 1 in 2, so roughly 50% of people in Canada will experience some sort of mental health disorder by age 40. For me, 40 is approaching quite quickly. But it's just to underscore the scope of the issue, how prevalent it is. And from an economic perspective, when we think about the costs, of course, we could estimate the burden in terms of lost productivity, the health-related costs, the criminal justice costs. But the vast majority of the costs are really intangible and can't be quantified, whether that's on people, on your families, on communities, on economies. And then here in Canada as well, and this is not a surprising thing to a lot of people, is that Indigenous youth, in particular boys, are disproportionately affected by mental health disorders and tend to have higher suicide rates as a result of systemic colonialism and ongoing effects of that. So the overall picture pre-pandemic was one of crisis here in Canada and across the globe. So here are these little charts just to reinforce the uneven access to treatment, to support, to specialists. Here in Canada, roughly 75% of children with mental health issues are unable to access in a really timely manner, access to specialized treatment that they need. If we look at Nigeria or China, that number is even higher, where only people with really severe cases of mental health issues are able to access specialists or treatment. And then in the US, roughly 67% of Americans are unable to get access to the care that they need. So clearly, again, what we see, a huge demand far outstripping the supply of services, of specialists, of treatment that people really need to get better and to be able to function fully within their societies. So this chart is from an incredible Lancet article that I came across, and it's really looking at the pre and post pandemic impacts on our mental health globally. Now, this was commissioned, it's a systematic review that was commissioned by the WHO in conjunction with various partners from around the world. And what you see here, so the bar charts show the baseline cases of anxiety as well as depression. And what you see here is that as a result of COVID-19, we have an additional huge numbers of people who have developed anxiety, who have developed depression as a result of the pandemic. Now, anxiety and depression also tend to be more prevalent amongst females in particular for various reasons. And so here what we see is that a disproportionate impacts of COVID on younger age cohorts. You see the disproportionate of COVID on women in particular, just again, at the same time as we're grappling with the pandemic is still unfolding, we're not fully sure of the impacts, and yet we still have this issue of stigma if there is one opportunity, and I'm a very pragmatic person, so I like to see opportunity in most cases, is that as a result of the pandemic, mental health is becoming more normalized. We're having more conversations about it, which is a really positive thing to see. Now, here in Canada, the most impacted, similar to the trends that we've seen globally, females have been really impacted by the pandemic, healthcare providers, frontline workers, younger cohorts, those facing pandemic job-related stressors, they've lost their jobs, they've had to take time off work, Indigenous people from the LGBTQ +2 community, and then new recent immigrants, and of course, those for whom those identities also intersect. So you could imagine that these issues would be really compounded for a lot of people here in Canada and globally. And when it comes to gaps and opportunities, here in Canada, there really isn't a lot of robust, shall we say, comparable mental health stats or data. So the Canadian Institute of Health Information does a great job publishing a plethora of health data, expenditures, outcomes, life expectancy. But if you were to go to their website on their dashboards, you'd see that for wait times to access community mental health support, there are very few provinces and territories that actually report that information. So one of the biggest data gaps that we have here is really a lack of national representative and comparable data, especially for children and youth. And some of the other panelists who will join, who are clinical experts and have that expertise, could expand more on that issue. And then, as well as in a lot of the studies, we don't see representation from racialized groups, from Indigenous groups, from members of the LGBTQ +2 community, people who are already disproportionately affected. And so that also compounds the issue of how do we target interventions to those most impacted. And where there's an opportunity is to really increase the number of population-based longitudinal studies. So fortunately here in Canada, we do have quite a number of cross-sectional studies, but the gold standard really would be, apart from randomized clinical control trials, we'd be looking at longitudinal data, so we could look at pre and post, get that baseline data and assess trends over time, and also help us to facilitate more robust inferences to make sure that we're implementing the most effective interventions. And then wait times, I mentioned, getting a better sense, better data on wait times for children to access mental health services, for youth to access mental health services, and for the groups, the most marginalized groups, or people with pre-existing mental health issues. One could imagine that for them, the pandemic has really exacerbated their mental health and well-being. So on the issue of data, the Canadian Mental Health Association, in conjunction with researchers from the University of British Columbia, have been monitoring a series of surveys. They've been conducting a series of surveys since May 2020, just trying to track over time the mental health of Canadians. And what you see here in these two charts, so between May 2020 and December 2021, is that in May already, I mentioned the disproportionate impacts in certain groups. You see that reflected here. So whether that's Indigenous, you see a much higher percentage. And then one interesting thing that will stand out for Albertans is that in May 2020, roughly 30% of Albertans surveyed reported a decline in their mental health. As the pandemic progressed, by November, December 2021, that number had actually increased to 46%. So as we dealt with various waves of public health measures, closing, lifting, and what have you, you could see also the impacts on people's mental health. And these two charts here just kind of illuminate that. So what works according to the experts in this field? Normalizing mental health as a public issue. I mentioned that one positive, if I could use that word, about the pandemic is that now more and more people are having conversations about mental health, and it's no longer shrouded in the secrecy and the stigma that it was previously. So that is one positive. And also target, and we've heard a lot over the last 2 days about the social determinants of health. Right? And that includes things like income support, that includes things like housing, and also that includes looking at taking an intersectional approach to ensure that those who face various issues of marginalization and underrepresentation are also included when we're looking at longitudinal studies or cross-sectional studies. So addressing those data gaps will certainly also go a long way to giving an overview of what the actual needs are. And according to the experts, also taking a system-wide perspective and trying to integrate that perspective into the recovery plan. So we're talking a lot of governments, a lot of policymakers are now talking about building back in a more equitable manner, a more inclusive manner. So how do we do that in a way that is also, that will also set us up and implement the mental health supports and have the resources allocated to it to ensure that as we recover from the pandemic, we are allocating resources to that area as well. And then also seeing a role for workplaces and for employers, right? And for a lot of people who are fortunate to have extended health benefits, they can avail themselves of those additional supports. So there's certainly a role for employers here in Canada and across the world to really play, according to the experts, when it comes to improving access to mental health. And on that note, what are we at ATB doing? So our partnership with a Social Progress Imperative predated the pandemic, and it was quite prescient, actually, because one of the key insights that we took from the SPI is on the mental health, the data gaps on the mental health side of things. So that has really informed the work that we're doing at ATB. So here, this map shows the overall Alberta Social Progress Index, where the darker the colors, so the purple areas are areas where the SPI scores are lower, and areas where we need to allocate more resources, and areas of opportunity that we need to address. Alrighty. Now, how do we move from the SPI, so moving from index, as the SPI folks like to say, index action impact, how are we doing that, leveraging the index? I mentioned already the mental health data gaps that we noted in the Alberta SPI. And so one thing that we have been doing is, in conjunction with our various partners, trying to advocate for better data collection, better data recency. We know that, I used to work in health analytics, so I'm quite familiar with some of the data sets that are collected in this space, but for various reasons, a lot of the data are not publicly disclosed. So how can we engage with the relevant stakeholders to advocate for better data availability and publication? And one area that we've also really leveraged the SPI is by incorporating it. It's informed our Greater Good strategy as a purpose-led organization. Yesterday, when our CEO, Curtis, spoke, some of you would have heard him mention that at ATB, we are a purpose-driven organization. We are also data-driven. And as we evolved our CSR approach to be more data-driven, the SPI has been quite instrumental in that regard. And mental health, of course, has been a priority for ATB for quite some time. Our CEO sits on the CMHA mental health on the CMHA board, and we have various other senior leaders and team members for whom mental health is also a priority. So just to reinforce that commitment to employee mental health and well-being, as well as to the community. Now, in terms of impacts, how are we making an impact and where are we seeing the impact? So improving access to mental health support is a key area of focus for us at ATB. And as part of this, we consulted with partners from the community, from nonprofits and post-secondary institutions to come up with 3 challenge statements that would really guide us in terms of where we allocate resources and our focus. And so here we have various organizations, some of whom I'm happy to say are here today and have joined this conference that we're working quite closely with, and then a various number of initiatives that we've also undertaken over the last 2 years to support mental health and well-being in our community. So at ATB, I think one of the most important ways that we're making a change is that we're really redefining what social progress means. I mentioned the other day when I presented that we are a wealthy province, and we tend to have really high GDP. But from a social progress perspective, we're also really paving the way and innovating by redefining what well-being means beyond just our high GDP. We now have the Alberta SBI to inform social progress in this province. Thank you.